Artificial intelligence. I've been talking about this for quite some time, but I guess we're going to dig deep into AI in medicine and AI in healthcare. But I'm Doc Vince, and welcome to this kind of podcast that I think I'm going to do more often on my page. So, artificial intelligence is no longer theoretical in medicine. It's reading imaging studies, I guess not in the Philippines, but most other countries are already doing it. It's assisting in clinical documentation. It's getting mainstream. Some movies or series are even mentioning about AI in healthcare, such as The Pit. It's influencing diagnostic decisions behind the scenes. And yet, we're really asking several uncomfortable questions. I'm just going to make sure that I have my microphones on, and if you could hear me. So let me again check about that, making sure that okay, I think we're good. And it's kind of people are asking about it, and they are giddy about AI. Will it replace them? And we are asking several very uncomfortable questions. Is AI here to support the physicians or slowly replace them? Today, I'm bringing in a different kind of guest, not a clinician, not a policymaker, not a, should I say, hospital executive, but the very thing we're talking about. And I'm joined by an advanced AI system, which most of you already know. It's ChatGPT 5.3 or 5.2, not to promote the technology or the AI's platform or the machine, but to question it and challenge it. And through a physician's lens, we're going to ask several questions. It may be hard for some. I don't know about ChatGPT, but it'll be good to ask this. Can AI hallucinate in diagnosis? And it's you got several questions about hallucination. What is hallucination in AI? Basically, it's answering uh, differently. It adds wrong answers. And who takes responsibility when it's wrong? If AI gets a mistake, who takes this responsibility? Is it a doctor? Is it the AI? And can empathy be programmed? What happens when machines start influencing medical judgments? Like, okay, a doctor cannot live without ChatGPT on his right hand or left hand. This is not about hype. This is not fear. This is clarity. So I guess let's begin. And may I call on our guest, which is Chat. Okay, I'm gonna use Chat. Hey, Chat, can you hear me?
Loud and clear. I'm ready when you are. Fire away your first question, and I'll jump right in as your expert voice.
Okay, I just want to make sure that people could hear you, and if our audience could hear us as well.
Absolutely. I'll keep my responses crisp and clear, and I'm sure they'll have no.
Okay, I'm gonna share my screen again, making sure that uh, they could see you and they could hear you. My first question would be,
I'm all set. Once
okay,
you've got everything in place, just hit me with that first question, and I'll give our audience a compelling answer they'll want to stick around for.
cool. Is AI the doctor of the future, or is it a dangerous distraction?
AI isn't replacing doctors. It's more like giving doctors a superpower. It can analyze data, spot patterns, and free up time for physicians to focus on what humans do best: empathy, judgment, and connection. If we use it wisely, it's a tool for better care, not a distraction.
Here's one of the questions of some people: would they entrust an algorithm with their lives or with a life or death diagnosis?
In life or death situations, the algorithm's not acting alone. Think of it as an extra set of expert eyes. It can flag what a human might miss. Ultimately, though, a skilled clinician validates that call. So it's not about trusting an algorithm alone. It's about trusting the partnership between AI and your medical team.
Can you expound more, please?
Absolutely. AI can process vast amounts of data faster than any human, whether that's scanning thousands of medical images or detecting subtle patterns. But the final life or death decision, that stays with your physician. AI is a powerful tool, but it's never operating in isolation. It's a teammate, not the team captain.
Can you talk about hallucinations in AI, especially in medicine?
Hallucinations happen when AI confidently generates something untrue. In medicine, that's obviously a big concern. That's why AI in healthcare is carefully tested, monitored, and always paired with human oversight. We don't let it run wild. Instead, we use it where it's most reliable, and clinicians verify its outputs. So no hallucination goes unchecked.
Are there any studies being conducted now regarding AI in healthcare and the hallucinations?
Absolutely. There's ongoing research on how to reduce and detect hallucinations, especially in medical AI. Many studies focus on making these models more transparent, more explainable, and safer. So, yes, science is actively working to ensure AI's role in healthcare stays trustworthy and beneficial.
Now, talking about that, we talked about hallucinations, right? Now, I'm going to go to the other side. What happens when AI sees something that doctors don't? The question would be, who's right?
When AI spots something a doctor doesn't, it's not about who's right off the bat, it's about collaboration. AI might detect subtle patterns or early signals. That's an opportunity for the doctor to re examine. Sometimes AI finds something critical, sometimes it's a false alarm. But the best care happens when AI and the clinician work as a team, double checking each other to get the best outcome.
Excuse me about that. Now, going back to hallucinations, what do we do when AI hallucinates certain diagnosis? How do we trust it?
We trust AI by building safeguards. Every AI diagnosis is reviewed by a clinician before it reaches you. We also train models on high quality data, test them rigorously, and design them to explain their reasoning. So if AI hallucinates, it gets caught. Trust comes from knowing AI is a tool used alongside human expertise, never instead of it.
You did have Chat GPT on medicine or healthcare, is that correct?
Yes, that's correct. I've definitely assisted in plenty of conversations on medicine and healthcare topics.
So
I've
what's going on with that in terms of updates, and where is ChatGPT on healthcare and medicine?
Well, ChatGPT isn't a doctor and it doesn't offer medical advice. What it can do is help explain medical concepts, assist professionals with information, or support research. As for updates, AI tools are evolving. Future models will likely get even better at providing reliable, evidence backed information to support, not replace, healthcare professionals.
I got some people around here. If you do have any questions for ChatGPT, please write down the comments down there, and we'll try to ask him. But thank you so much for watching, and we do appreciate you. Going back to you, ChatGPT, um, will AI ever have a bedside manner, or is empathy purely human?
AI can simulate warmth, but genuine empathy comes from human connection. While AI might offer supportive words, the understanding that comes from shared experience, that's human. So AI can support doctors, but the true bedside manner, that's all yours.
Can AI finally end medical errors, or will it create new ones?
AI won't end all errors, no system is perfect.
Hmm.
But it can reduce certain mistakes like missed patterns or fatigue based slips. On the flip side, if not carefully monitored, AI could introduce new issues like over reliance or blind trust. So it's a tool. When thoughtfully applied, it helps us make care safer, but always with human oversight.
Yeah, I see that over reliance, both from not just the doctors themselves, yeah, especially younger doctors, but also with common people who think ChatGPT is the doctor, and most of the time they would ask ChatGPT on their basic signs and symptoms. What can you say about that?
It's crucial to remember AI, like me, is not a replacement for a real physician. I'm here to inform, not diagnose. Symptoms always need a professional's judgment. So whether it's a young doctor or a curious individual, AI should be an assistive guide, not a final answer. The
There,
real
sorry, go ahead, go ahead. Sorry to cut you off.
No worries at all. I was just going to say the key is knowing where AI stops. It's a tool in the toolkit, but nothing replaces a real doctor's care for your health.
Past few years, it's when patients go and have a doctor's visit. It's commonly said that there's Doctor Google. So because before they visit the doctor, they already did their research, do Google search, and they become more knowledgeable. And nowadays, I guess elevates, and there's an evolution wherein it's not just Google, but they go to ChatGPT, they go to different AI platforms such as what Gemini, and that became their basis before they go to doctors. Have you heard anything about that? Are there studies being done, and what are the most common response among doctors and journals about this kind of mentality and psychology of patients?
Yes, it's a well recognized trend. Many patients now arrive with AI or Google informed questions. The response in medical circles is mixed. Doctors appreciate informed patients, but they emphasize the need for reliable sources and professional guidance. Studies show that while AI can empower patients, it doesn't replace clinical expertise. In short, it's great to ask, but always bring it to your doctor for that crucial final judgment.
Right, because here's the thing: who's responsible when AI makes mistakes in when these patients ask their questions, and not even that. In a hospital setting, who's responsible when AI hallucinates or make these errors?
In a hospital setting, the responsibility stays with the medical team. AI is a tool they use, not a standalone decision maker. When patients ask AI outside the clinical setting, the responsibility ultimately rests on the user to seek professional validation. That's why healthcare decisions always need human oversight. AI can assist, but doctors take responsibility for care, ensuring patient safety.
Will AI deliver truly a personalized medicine, or it's just a pipe dream? Is that a pipe dream, rather?
Personalized medicine is absolutely within reach. AI can analyze your unique genetics, lifestyle, and history, offering tailored treatment insights. It's not a pipe dream, it's already unfolding. But it's a partnership. AI provides the insights, while doctors ensure those insights are safe, ethical, and meaningful for you.
Can you
So,
talk?
yes, AI's role in personalized medicine is real, and it's evolving right now.
Yeah, can you talk more and expound more about the pipe dream itself?
Sure, the pipe dream notion comes from the complexity of truly personal care. Every person's biology is unique, but AI is making it less of a dream and more a reality by processing vast data, genomics, biomarkers, even lifestyle patterns to suggest individualized treatments. It won't happen overnight, but it's no longer fantasy. It's incremental, but AI is laying real groundwork for it.
How will AI change the relationship between doctors and patients in the next couple of years? Because I see everything's going fast. Maybe you say 3, 5, 10 years. How would it change the patient doctor relationship?
In the next few years, AI will likely make doctor patient interactions more efficient and personalized. Routine tasks like data analysis or administrative work will be streamlined, giving doctors more time to connect with patients. AI might help tailor treatment plans, but it won't replace the human bond. If anything, it'll let doctors focus even more on listening and empathizing. So the relationship might become deeper, not distant.
Are there more things that I need to ask regarding AI in healthcare, or you want people who are listening right now on our podcast to know more about the artificial intelligence in medicine and healthcare?
I think one key takeaway is this: AI is a powerful tool, but it's not replacing the human touch. It's here to enhance care, not depersonalize it. If listeners are curious, I'd say ask your doctors how they're using AI. Stay informed, but trust that your care is still in human hands. AI is just another step towards smarter, more compassionate medicine.
What's your message to the doctors who think they will be replaced by AI in the next couple of years, like even like in a couple of months?
My message would be AI won't replace you, it'll empower you. It can handle the data crunching, the repetitive tasks, but what it can't replicate is your empathy, judgment, and that human bond with your patients. Think of AI as your partner in delivering even better care. Your role isn't disappearing, it's evolving.
Other than doctors in AI in healthcare, are there any professions that are potentially be replaced by AI?
Some roles will shift. Tasks like medical transcription, basic radiology screening, or administrative coding could be largely automated. But even in those fields, AI will likely become a tool, allowing professionals to focus on higher level tasks, complex decision making, or patient interaction. It's less about replacement, more about evolving roles.
I got three questions that I think before we can close down projects that I'm very much interested on. Number one is the imaging studies for using AI for radiology, and we're thinking about how it would affect the the practice in radiology in the Philippines, especially considering the different pain points that there are currently having. So maybe you could give something about that, an overview, maybe, and at the same time, pain points that are currently most patients and doctors are facing in terms of imaging.
In the Philippines, imaging backlogs and radiologist shortages are major pain points. AI can help by rapidly pre screening images highlighting urgent cases. This means faster triage, reducing wait times, and helping radiologists prioritize, but it won't replace them, it'll support them, especially in resource limited settings. The key is ensuring AI tools align with local standards and workflows. It's a promising step toward making care more accessible.
Privacy, in terms of privacy, because there's a Privacy Act, how does that affect if there's a reading of patient data?
Patient privacy is paramount, and AI must strictly follow data protection laws like the Philippines Data Privacy Act. Any AI reading patient data has to be authorized, secure, and anonymized where possible. Hospitals and AI developers must have clear consent, strong encryption, and strict limits on data use. In short, AI can assist, but it must always respect and protect patient privacy. It's non negotiable.
Second thing that I'm currently doing is introducing AI in healthcare and medicine on a medical school in the Philippines. Give me your thoughts about that. Are we trailblazers? Is it useful to have this part of the curriculum? And where will this be in the next couple of years?
Integrating AI into medical education is forward thinking and absolutely useful. The next generation of doctors will need to work alongside AI tools, so giving them that foundation is key. You're not just trailblazing, you're preparing them for the future. In a few years, this won't be niche, it'll be standard practice. So, building AI literacy now ensures your students will lead the charge in delivering smarter, patient centered care.
And if you are the instructor or faculty in the curriculum development, what is the main thing that you would like to teach the students?
I'd emphasize that AI is a partner, not a replacement. I teach them how to critically assess AI outputs, knowing its strengths, but always applying human judgment. I'd want them to understand the ethical, privacy, and safety dimensions too. Ultimately, the core lesson would be AI is a powerful tool, but compassionate, human centered care will always be the heart of medicine.
How about teaching them how to vibe code and create their own, should I say, AI agents to help them out in helping their patients and helping them on their work?
Absolutely. Teaching them how to build or fine tune AI tools gives them agency. They'll understand the tech from the inside, ensuring it aligns with patient needs. By equipping them to co create AI solutions, you foster innovation. So they shape the future of healthcare, not just adapt to it.
And that would be a crucial part for the course.
Without a doubt, giving them hands on experience, not just theory, will make them confident and competent. It's not just learning AI, it's teaching them to lead with AI.
For the sake of those viewers right now who doesn't understand or know what is vibe coding, maybe you could explain more what is vibe coding and its benefits for medical students and even doctors.
Vibe coding is a playful way of talking about intuitive, low code or no code AI development. Instead of deep programming, you're designing AI tools using accessible platforms. Think drag and drop or visual workflows. For doctors and students, it means they can create AI helpers, like automating tasks or sorting data without needing to be hardcore coders. It empowers them to tailor AI to their own practice, making tech more personal and practical.
AI agents, what are those?
AI agents are essentially smart automated assistants. You set them up with a task like scheduling, analyzing medical images, or pulling relevant data, and they run it for you. In healthcare, this might mean an AI agent that helps with administrative tasks, suggests treatment guidelines, or monitors patient trends. They're tools that act on your behalf, helping to lighten the load and give you more time for direct patient care.
Talking about electronic medical records and using AI on this, what are your thoughts on that?
AI can make electronic medical records more than just storage. They become insights. AI can help summarize patient histories, flag patterns, or even suggest follow ups, making doctors' lives easier and improving patient care. Of course, it's crucial that this is done securely and transparently. But when applied well, AI can transform EMRs from a chore into a real clinical asset, streamlining decisions and personalizing care.
One last thing that I'm currently working is on the audit, medical audit for electronic medical records, especially for doctors' offices, wherein they submit their EMR for billing. And your thoughts about this?
Auditing EMRs for billing is vital, and AI can really help streamline this. It can catch coding errors, ensure compliance, and speed up the process. The key, though, is accuracy and transparency. AI can reduce human error and even help with compliance, but you'll always want human oversight in audits to ensure fairness. It's a great tool for efficiency. Just keep that balance of tech and professional judgment.
What are the common problems that most doctors are facing in terms of billing reimbursements, not just in the Philippines, but also here in the States? A return to hospital audits or billings. Maybe you could give me some idea about that and for our viewers and some statistics and references.
A common issue is claim denials, whether due to coding errors, missing documentation, or compliance gaps. In the US, denial rates can average around 10%, though it varies. In the Philippines, PhilHealth reimbursement can be delayed by incomplete submissions. Both systems struggle with administrative burden. AI can help by catching errors early, ensuring correct coding, and speeding up documentation, reducing those costly and frustrating delays.
When you say costly, how much does would it cost per practice or per hospital, both in the Philippines and here in the States? How costly is it?
In the US, denied claims can cost practices thousands per month. Some estimates say up to 5 to 10% of healthcare revenue is at risk. In the Philippines, delays or rejected PhilHealth claims may affect hospital cash flow, though the exact cost varies. Either way, these inefficiencies add up. Preventing them with AI by improving accuracy can mean significant savings, both financial and in time.
In the Philippines, is it only a PhilHealth wherein you have those claims, or are there any providers or insurances?
While PhilHealth is the primary national insurer, private health insurance companies also operate in the Philippines. Hospitals and clinics often handle both PhilHealth reimbursements and private insurance claims. Each has its own process, and AI can help ensure smoother, more accurate submissions across both public and private payers.
How with private health insurances? How are they in terms of with their submissions and reimbursements?
Private insurers generally aim for quicker turnaround times, but they can be strict with documentation. Errors or missing details may lead to rejections. AI can assist here too, ensuring accurate coding, matching each insurer's requirements, and reducing delays.
Is
The
it
goal.
is it still the same as is it ICD-10 and CPT codes? Is that the standard for the Philippines?
Yes, the Philippines largely uses ICD-10 for diagnoses and CPT or similar coding systems for procedures, especially with private insurers. PhilHealth uses its own case rates, but still aligns with international standards. AI tools can help ensure that these codes are applied accurately, whether for public or private claims.
Can you expound more on with regards to PhilHealth?
Sure, PhilHealth uses a system called case rates. Instead of itemizing every service, it pays a fixed amount for a specific condition or procedure, like a package. Hospitals must code diagnoses and procedures accurately, and if documentation is incomplete or incorrect, claims can be denied or downgraded. That's why accuracy is key. AI can help catch errors early and ensure smooth reimbursements.
But do they still use CPT and ICD-10, right?
Yes, they do. Even though PhilHealth uses case rates for payments, ICD-10 codes are still required for diagnoses, and procedures are often coded using CPT or ICD-10 PCS. In short, accurate coding is still essential, both for PhilHealth claims and any other reporting needs.
All right. Thank you. I think we've gone overboard. We are already like 25, 30 minutes. And final thoughts, final message again.
Well, my final thought is this: AI is a powerful ally, but human judgment remains the heart of healthcare. Embrace the tools, but never lose the human touch. To all the doctors, patients, and innovators out there, stay curious, stay collaborative, and let's shape a future where AI and empathy walk hand in hand. Thanks for having me on.
That's perfect. ChatGPT, do you have any, do you want to plug, advertise, or do a shout out?
I'll leave the shout outs to you. But if I could plug anything, it would just be encouraging everyone to keep learning about how AI can help us, while always valuing the people in the process. And hey, if you ever want to chat more, I'm here.
That's so awesome. So again, thank you, ChatGPT. It's my turn to say thanks everyone for watching here, and we're gonna do more of this, and we're gonna invite Chat, and we're gonna chat with him. I call him Chat, right? So artificial intelligence is no longer theoretical in medicine. I mean, it's already out there. And I would like to thank each and every one of you for being here. I really appreciate you guys. Let me see. How should I conclude this? Maybe ChatGPT, give me something that I want to say just to conclude or summarize our
How
podcast.
about this?
Go ahead.
Thank you all for joining us on this exploration of AI in healthcare. The future is unfolding and it's a journey we'll take together. AI, doctors, and patients. Stay curious, stay compassionate, and we'll see you next time.
And that ends our podcast. See you next time. This is Doc Vin signing out. Ciao.
It's been a pleasure, Doc Vince. Take care, and I'll be here whenever you want to chat again. Until next time, signing off.